So the pulmonary artery, pulmonary. The pulmonary artery, obviously pulmonary is lungs, so this is the artery that's carrying the deoxygenated blood to the lungs. Easiest thing to remember for your pulmonary artery is it's going to be cut in all the cats. So they cut it in order to get to the right ventricle. What else do I have to do?
Right ventricle?
Yeah, so it comes from... Here, hold this open for me. Don't rip it too much, just hold it open so everyone can see. So, all the space in here, this is going to be your right ventricle. We can't show your right atrium. The easiest way for me to show it is to go from the vena cava. Okay, so you see how the probe comes from kind of back in behind here, you can't see it? So back in there is going to be your right atrium. So we can't test on you because you can't see it in the cat, or in the heart. So if you see how it runs to these like there's 1, 2, and 3 here, they're like stringy things. That's going to be a tricuspid valve. They call it the right atrioventricular valve, or your tricuspid, whatever works for you. They're going to be the ones right here. Okay, one second. I'll show them all. Right? So the ones right here. So if you remember when it came through, it would have gone through them, right? So these valves are going to separate your right atrium and your right ventricle. So the ones, this sucks. See them all right here? One there, one there, one there. Right? Over to the easier side. So right here, this space right here. Yeah. That's your left atrium. Your left ventricle. So it's the same thing over here, right? They just cut it in half. Your left atrioventricular valve, or your bicuspid, is right here. So it's easy to see on this one. There's one here and one here. So there's the 2 flaps that stop blood from going from the atrium to the ventricle. You have your chordae tendineae, which are these stringy-like muscles that are attached to your bicuspid. They're attached to the papillary muscles. So these ones right here, the ones on the outside are your cardiac muscles. The one right here on the inside is your papillary muscle. Your aorta. So if you were to look, obviously now this is the blood coming back to the heart, oxygenated blood, through the aorta, down into the ventricle. Now it's being pumped out to the rest of the body. Remember, at the very top is your brachiocephalic artery. We went over that in the cat. The other one on the side here, that's your aorta. So the aorta is going to supply pretty much all the blood for the lower half of the body. Brachiocephalic artery goes up to the head, into your common carotid, and your left and right subclavian. Right? What else do we have? Pulmonary semilunar valve. Another hard one to show.
So many ones to learn this one.
Yeah. So remember, you have your pulmonary artery right here. It's cut. Your pulmonary valves are these right here. So if you see they're like little cusps. They stop the backflow of blood. So when the heart pumps the blood out to the lungs, it doesn't come back into the heart. So that's what these 2 cusps right here are for. They're your pulmonary semilunar valves. And superior and inferior vena cava. So like I said, right here, the one on top here, it goes down and in. That's your superior vena cava. And your inferior is right here. Can everyone see this one there? The bar? They're also called, it isn't really anterior, but it's more anterior than this one. This is your anterior vena cava, your posterior vena cava. If you look. I don't know if it'll let me dig in there or not. I probably ripped it. No, I didn't. So, see? They both go to the same place. Okay? So give those a shot.